Thank you very much, Kathy, for the introduction. I've been, yes, dashing around the world giving wonderful talks. Today is not one of those. No. I'm actually put this together specifically for you because I was thinking about what I might have to say. Some of you have taken the Indigenous focus area of study, and so you've heard me talk about some of the Indigenous issues around in public health, and I know that most of you, if not all of you, were around, and I met you at your gateway, and we talked about cultural safety. But I thought this morning, maybe what I would talk a little bit about is some thoughts around the kind of work that you might be doing in your careers, and how an Indigenous perspective on some of those core competencies that you've been learning about over the course of your studies might be relevant for you. So hopefully it'll be somewhat interesting, relevant for you. As Kathy said, we like to acknowledge that we are on the lands of the Lekwungen speaking peoples, and those include, just in the context of the territory that we're located on now, the Songhees and the Esquimalt and the Wasanich people. And so most of you know that I'm Mi'kmaq from Mi'kma'ki and also French Acadian, and so I come here as a grateful visitor, bringing the teachings from my family and my ancestors with me. And so I always want to remember that while I'm here, I want to make sure that I am respectful of the lands and the customs of those people, and that I don't do anything that would disappoint them. So just wanted to say that and introduce you to some of my family. And so who remembers the public health core competencies? This is did they tell you it was a quiz? Does anybody remember them? Oh. Well, that's great. You're going to have to start in year one again. So just a refresher here. So these are the core competencies that schools of public health hope that you leave with, and that you're able to demonstrate. That you have some content knowledge as well as historical knowledge in various areas related to public health, that you can take that information, that you're able to assess its value, its relevance for different issues, and that you can analyze it in ways that is useful for policy and programming, that you're able to actually take action on those things, that you're able to identify appropriate actions and then evaluate those actions relative to the groups that you're working with, and that you engage in respectful partnerships, that you advocate for folks who maybe can't advocate for themselves, that you collaborate well, and that you are mindful of diversity and inclusion, and that your communication and leadership skills are such that you're making a contribution to public health. And so that's literally a nutshell. And now you can remember them the next time someone asks you. But I want you to think about, as you sort of go off into your maybe the work that you're already doing, or the work that you're going to engage in, and think about how those competencies might apply to work with Indigenous peoples and communities. And I wanted to just pause there for a moment, because folks are often confused about or not clear about what we mean when we say Indigenous communities. And so I find this description from the TCPS, so this is the Tri-Council Policy Statement on Research Involving Indigenous People. That's the Chapter 9. You took research methods. I'm assuming you heard about this already. And so the TCPS says that community describes a collectivity with shared identity or interest that have the capacity to act or express itself as a collective. And so that can be folks with multiple cultural backgrounds, and it could be organizations or communities of interest. So in the context of Indigenous peoples, Often people assume that we're talking about First Nations communities when we use the term community. But I want you to think more broadly in terms of this description. So that can be urban people who see themselves as a collective, have a collective interest in the health of urban people. It could be Métis people who often don't have a land base, but still identify themselves as a collective of people. It can be an organization. It can be an association, right? So I work a lot with the Canadian AIDS, Aboriginal, I should know this, the Canadian Aboriginal AIDS Network. And so that's a network of centers and individuals across the country that work in collaboration and in solidarity for the wellness of Indigenous people who are living with HIV. So again, people will often think, oh, I'm not working with Indigenous communities because they're not working with a specific First Nations community. So I really encourage you to think a bit more broadly about what that term can mean and maybe take a page from the TCPS on that one. So what I'm going to ask of you today is to think about some of these questions that I'm going to be posing around these core competencies as they relate to Indigenous peoples. And ask yourself these questions, not just today, but throughout your career. And so even when you're not specifically or expressly working with Indigenous peoples and communities, there are elements of your work that are going to impact those folks, or those folks are going to be implicated in your work in ways that you might not be thinking about now. And so I guess this is really just a request that you start to think about these things throughout your career in terms of these core competencies that you've been studying over the years in one way or another. So the first one around this notion of public health science is whose knowledge and how are we applying it, right? And so we're often, in our studies, but also in our careers, asked to review evidence or information, right? And so we have to start asking ourselves, where does this knowledge come from? Or how is this research being undertaken? So if it's specifically focused on Indigenous people, those questions are critical. But it's also important for us to ask ourselves, how are Indigenous people implicated in this, or neglected in this, or ignored in this information, right? But there's a consequence for them. So we have to think about, what do we value as knowledge? Or what kind of research do we value? And I would say there's value in all knowledge. We just have to be critical consumers of that knowledge, particularly when it comes to lots of different marginalized populations and folks. But for today's purposes, I'm just talking about Indigenous folks. And so the other issue that's been emerging over the years is this notion of the pathology of information about Indigenous peoples, right? And so prior to 2000, even 2010, I'm looking at Jeff Redding. Jeff was the scientific director, the inaugural scientific director of the Institute for Indigenous Peoples' Health at CIHR. And so I just want to acknowledge that his contribution to this area and to the conduct of Indigenous health research in Canada was groundbreaking and literally has changed how we look at this. So I'm going to defer to him in some respects. He's also my husband, but that's a different thing. And so what we want to say is, what we want to think about is not only where is this information coming from, but what kind of focus is this information? So if all of the information you're receiving about Indigenous people is about our illnesses and the burden of our health, our social problems, our substance abuse, our mental health problems, our violence, all of that, that's a deficit focused, and that is unbalanced, right? We think about balance as health, that's unhealthy information, right? It's not really balancing what we know about Indigenous peoples, which is there's lots of strength and lots of capacity among Indigenous peoples, communities, nation states, right? And so you have to ask yourself, am I engaging in a strength-focused way, or am I using that lens when I evaluate information about Indigenous people? At the very least, am I trying to balance the heavy burden of pathologizing research? And even if you're doing research, am I contributing to that pathologic view of Indigenous people? And I know, because I know this program, and I know that we are taking a real social determinants and health equity lens, and so I know that folks that have taken my classes, and I'm sure that folks that have taken other classes do have a clear understanding of the inequities that Indigenous people are facing, what those social determinants and historical contexts are, and as well as the structural context of health. And if you're not as familiar as you feel like you need to be, then there's always self-study in those areas. But it's important to understand those without, again, imbalancing your knowledge base around Indigenous people. And then it's the application of that information that becomes critical in the work that you all will do, right? So people like me, we gather information, we share information, we hopefully make sense of it and make meaning of it in ways that is balanced and useful to communities as well as professionals and practitioners and policymakers. But it really is the responsibility of folks like you and the folks that you work with to make sure that that information is applied in a culturally appropriate and sociopolitically appropriate context, right? And again, the best information is useless if it's not applied in those healthy ways, right? And so we'll talk about that in a little bit more detail in a minute. And then there is this commitment to learning. And in the competencies, it's a commitment to learning, lifelong learning around public health. But I would ask you to think about making a commitment to lifelong learning around cultural safety, because I know we talked about it when I first met you, and hopefully you've learned about it a little bit more in the last couple of years. But it is important that you make a commitment to doing that throughout your life. We don't become culturally safe or competent at any particular time. And even as Indigenous people, we're not necessarily always culturally safe, and so it's important for us to keep learning as well. And so making that commitment and then acting on that is one of those core, I would say more of a value, but a commitment that public health professionals, once it's made and if it's actioned, then it makes a huge difference. In addition to just the work you're doing, the more culturally safe you become, the better able you're going to be to fulfill some of these commitments that I'm asking you to make. So the next competency is around this notion of assessment and analysis of information. And so again, you're going to be, or you already are, working in places where decisions are being made about Indigenous people that don't involve Indigenous people. And so I'm going to suggest that we all have a responsibility when we're working in systems over which we feel like we don't have control. We still have a voice, and one single voice can often influence others in ways that we might not see right away. But it's an important question to ask, even in the context of work, of your own workplace, when priorities are being handed to you about Indigenous people. It's important to ask, are these the priorities of Indigenous communities, of Indigenous peoples, right? Am I pursuing a priority that's really important or relevant to those communities, or is this just something that other folks from outside are making a decision about? And then about the assessment of information that we have, we often, again, we often assess information, especially in the academy, using measures that are completely irrelevant in a community context. And that's fine, as long as we stay in the university. If we're doing a systematic review and we're using sort of these models for determining the relevance or the quality of information, and we're just generating those things back to our own colleagues and staying in our little cycle of academia, well, that's, I would say, in some ways useless, but but that's just my opinion. But in terms of the community, it's not making change, right? So if we're going to assess the value or the relevancy of information that we're using to do something, hopefully that improves people's health, then community and culture should play a prominent role in determining the relevance of that information, right? If the information is generating something that we're doing in community, hopefully not on or with community, right? So the source of our, the credibility or the validity, whatever measure you want to use, should be coming from the target, if you will, of an intervention or policy. These things make perfect sense, but if you're not already working in the field, you'll find out soon that sense sometimes doesn't enter the conversation. So I ask you to be the voice of common sense. And then it's about meaningfully engaging community. Now, some people will say, how can I do that when I sit in a cubicle all day, or I have this one job that I do that doesn't allow me? What I would suggest to you is that when we're working with Indigenous people and other communities, we're making a commitment to do something outside of our paid work, of our regular duties, if you will. And so in some cases, even in the context of your work, you may be able to engage in ways that allow you to learn more about the local folks. So for instance, if you're working at the Ministry of Health, why not go have a lunch with Danielle Ben-Smith, who's the academic or the Aboriginal advisor to the PMO or something. Anyway, she's a lovely woman. There are people who work with you that you might just not know about. So maybe make it your business to know who's working in this area in the context of my own department or ministry or agency. Who's doing this kind of work? Are we doing this kind of work at all, right? Form maybe some network around folks that are interested in doing some of these similar things. Try to reach out just a little bit in the same way that you would to any other potential colleagues that you think might be useful in your work, that might contribute to your work, right? This is about making that extra commitment that we just don't often, it's just not on our radar to do that, or on some of our radars, right? And so I would encourage you to just think about how you personally, or even the department that you work in or the group that you work with, how can that group meaningfully engage with folks? And then it's really about thinking around this notion of cultural safety again, but attaching that to the conduct of research. Because if we're using the findings or the evidence that's generated from research, right, to inform our practice or our policies or our programs, we need to know that that research itself is culturally safe, right? So in addition to some research generating, imbalanced information that's, pathologic or stigmatizing, we can also, and Jeff and I have talked about this before, because we both do peer review at national levels, as do a lot of our other colleagues, and what we see is research that gets funded that does not meaningfully engage community, that does not sometimes acknowledge that Indigenous people are implicated in the research at all, when we totally are, right? And so it's important for you to understand, what kind of research is generating the information that you're that you're consuming and using, or if you're involved in research, if you're going on to do a master's thesis, if the agency you work at is doing a needs assessment, an evaluation. I mean, all of that is research. When you're seeking information for the purpose of using it and sharing it in some way, you're actually doing research. And so are you doing that in a culturally safe way, right? Are you engaging community? Are you gathering information, synthesizing it, interpreting it, and applying it in ways that Indigenous people are not going to find harmful? So you're also expected to engage in policy and program planning, implementation, and evaluation, right? And so, you know, policy is a tricky area to try to make change. Sometimes we can influence programs, particularly in this era of reconciliation where folks are kind of jumping on this bandwagon, and I can almost guarantee or maybe just predict that this isn't going to last. So like Jeff says, we make hay while the sun shines because we know there's a time limit on all of this. And so right now is a good time to engage policy decision makers and people who are planning programs, evaluating programs, implementing programs, to think about the cultural relevance or the cultural, I would say, maybe say it in terms of what is the lens, what is the Indigenous equity lens telling us about these programs and policies? This is a good time to do that, right? Because people are thinking about TRC. But those things are difficult to change. And so it's not about saying, you know, we all have to go out there and change the world, but we can voice our opinions, particularly in the arenas where we work, to suggest that there is a possibility for examining particular areas of those policies, of those practices, peer review being one of the ones that Jeff and I work in, and acknowledging that those peer review processes don't always identify Indigenous issues and potential harm done to Indigenous people until it gets to an ethics review process when it's pretty much too late. So I suggest that you just sort of think about, you know, be a critical consumer and user of the programs and the policies that are relevant to your workplace. And how many of you are going into sort of direct client service type work, where you're going to be working directly with folks? So just a few. And so, again, one of the important questions to ask yourself is, am I implementing something, a program, a practice, a service with the community members or on community members, right? And again, this, I'll talk about this in a minute, but this is about positioning ourselves in terms of our power relations with community. And sometimes it's about asking the difficult questions of our employers or our supervisors to say, you know, where is the community voice in this? You know, how is this engaging community in terms of what we're actually doing? Who's involved that should be there or who's not there at the table? And again, those priorities or those policies and those programs, ideally we want to be determining those things based on the priorities and the desired outcomes of community members, right? And so we might determine in our lofty intellectual ways that we need to decrease, you know, diabetes among Indigenous people. Nobody argues that diabetes rates are high, that they need to be lowered. But if you go to a particular region of the country, a nation state, a community, an urban center, and you ask people, what is the priority for your health today? Many times, they're not going to say diabetes. I mean, they might. But if you don't ask folks, what is the desired outcome? What is, first of all, the priority for your health? And what is the desired outcome of this particular program or this particular intervention? You know, it might not be what you think it is, because how would we know? How would we know if we can't even just go to our neighbor's house and say, hey, you know, it looks to me like your lawn needs to be cut. Well, the neighbor might say, yeah, my lawn might need to be cut, but my roof is leaking, so that's a priority for me right now, right? So we just don't know. We gather information from sources we're not even really critically evaluating, and then we assume that they, and that is the they, researchers like me, are the voice of authority for determining those priorities and what the desired outcome of that should be. One of the examples I can think of right away is an amazing research project that I have been invited to participate on. And I say invited because I don't lead anything. I'm invited by community to participate and sometimes to write a grant or keep track of the money, but that's not leadership. That's service. And so this particular grant, a group of Indigenous women living with HIV asked me to be involved in this project where they are coming together to talk about the ways in which they remain healthy in the context of living with HIV. Not the problems they're having, not how they became infected with HIV, not all the woes and sorrows, because that story has been told ad nauseum to their detriment. But what they wanted to talk about is how they're well. But one of the desired outcomes of this project for them was to gather with other women and to gain strength and meaning in their identity as Indigenous women, in their culture, in their spirituality, in their connection to others. That was more important to them than anything to do with their HIV status, right? Because they know something that many of us don't know. I'm not saying all of us. I'm just saying as researchers, we don't know. Someone living with what we consider to be a disease or a health issue may not be suffering in the ways that we think they're suffering. They may be suffering in a whole different way that has nothing to do with their disease process. Or they may be well in ways that we cannot imagine. And so I'm going to get off that soapbox. So again, super important to think about who's determining the priorities for what we do and the outcome that we're pursuing. And again, without community at that table, I'm not going to say that because I'm being filmed, we're going to screw it up. Is that okay? Well, that's better than the other word, right? It means the same thing, just in case you didn't know. I think I'm so old I can't remember, right, Nigel? Anyhow, I just turned 60, so yay. Yes, it's great. I'll be 70 in 10 years. Thank God. Yeah, and so the next question is asking yourself, A, do I even know what an Indigenous equity or an Indigenous determinants of health framework or lens looks like? Am I familiar with those? Because otherwise, it's like looking at something without a pair of glasses on. If you need those glasses, you can't see it, right? And so using frameworks and models that are relevant to mainstream, let's call it, or dominant populations is not going to tell you anything about Indigenous people. You won't see it unless you find and apply an Indigenous-focused equity or social determinants framework for understanding those issues, right? And those are frameworks developed by Indigenous people, right? No offense to non-Indigenous people who kind of think they have a framework that's going to work for Indigenous people. If it's not been developed by the people who are living that experience, it's not an Indigenous framework. So once you can see the issues through that framework, you can then start to, I'm not saying none of us are going to do it perfectly, but you can start to apply information in a contextual way that is actually going to be useful for community. At the very least, it's not going to harm people. And are we using culturally relevant models, right? So The frameworks, the equity and determinants frameworks is helping us understand the issues, the concepts that we're trying to grapple with, right? The models are ways of doing things that are, so implementation science is a great example. Jeff and I are both involved in some implementation science projects that are attempting to modify those frameworks. Have you seen the implementation science frameworks? Man, I don't know. I'd love to meet the people that developed them. Or would I? But those frameworks are developed by very intelligent people, but those things can be modified so that they have a more culturally grounded, informed, conceptual sort of ways of doing things. Implementation science being one of those ways of, understanding the context within which an intervention is being undertaken and how those things are shaping and influencing that intervention, right? And so those models are really useful in the same way that the frameworks, the sort of conceptual frameworks can help us understand something. Those models can help us do things in ways that are safer, that are more relevant, that are more useful to community. So again, those are questions we ask ourselves in that context of this particular competency. Isn't this exciting? So I think I just called myself boring. And so in the context of these partnerships, again, this is where I would say we need to think about starting because it is in our relationships with others that we really set the groundwork for the work that we can do, whether it's balanced, healthy relationships. And so, first of all, we need to think about what kind of relationships do we have with Indigenous partners. And email, conference calls, those types of things, they're not really relationships. And so in some cases, we actually have to make the extra effort to pursue those relationships, right? And how we develop those relationships is as important as how we sustain them. And so, for instance, I met for the very first time with the board of directors for the Association of Indigenous, or I think it's still called Aboriginal, Friendship Centers across British Columbia. Met them in Nanaimo last Saturday, because Saturday was the day they were meeting and Nanaimo was the place they were meeting. So I hauled my butt up to Nanaimo with a bag of gifts, because when we ask people to be put on their agenda, we follow the protocols of those peoples. And when we ask favors, and that includes people's time, of Coast Salish people, we offer a gift. 2 elders on that board, so those elders get an additionally lovely gift. I think I got them some honey and some tea towels and things that I thought would be useful for them, not a water bottle. No offense to anybody who gives water bottles. Do I have a water bottle down here? I'm just kidding, because I'm old, but I'm not an elder. And so I just realized my underwear is sticking out of my pants here. Hang on. Oh. Cut that part out of the video. Don't you hate that? And you're like, So gifts are very important to Coast Salish people. But if I was in Treaty 6 territory, Cree territory, I would find out what is the protocol for inviting myself or requesting something of someone. And that includes their time, a meeting, whatever, right? So developing those relationships in good ways, in respectful ways, following protocol is super important. Some people might say, oh, that's too much trouble. But I can tell you that it's like, dating, if people even do that anymore. There's a certain protocol. People, I think we call it a sexual script, don't we, Nate? I'm not suggesting you have sex with everyone you date. Anyway, we're getting off topic. And so, but what I'm saying is there is a protocol that you follow when you're trying to engage in a friendship, in a romantic relationship, with your pets, right? There are certain scripts that you follow. It's no different in this context. My filter's getting thin. Sorry. It can only last, I think 20 minutes is my limit for a filter. The other important thing to remember, and this is the tricky thing for people, because human beings, we crave control. We crave power and control. And I don't mean like in a megalomaniac kind of sociopathic way, although some people do. I didn't mean to look at you, Jeff. I just was nodding my head in that direction. But what I'm saying is that it's super important in order to show respect to folks who are often oppressed, marginalized, have usually a poor history with some of the institutions in which you're going to be working, this one included. We have to go the extra effort. That's what reconciliation is. We're like, we've done something now to damage our relationship. Now we have to go the extra mile to make sure that we're repairing that relationship. And one of the things that we, all of us, have to do is relinquish control. And that's really hard. We have to act as a resource to community rather than the expert that comes in and tells people what to do, or tells people how things are going to be, or what our policy is, right? That's a tough one, because it often requires us to not only do that individually, but we have to challenge our systems to do that and say, this is not equitable. This is not just. And we have to find colleagues and form, groups of people who will say that. And if we keep doing that, we make inroads into changing those systems. I better get going. What time did I start? All right, I'm almost done. Right, and so again, the notion of cultural safety in this context, in relation to partnerships and collaborations, is really about understanding what that means. What does it mean to be culturally safe? And if you recall from our first day that I met you all, it's first of all being an individual who knows who they are, who understands their social location in terms of the unearned privileges and disadvantages. And I say unearned, that means no matter what you do, this thing is not going to change, right? If you're racialized as white, that is a privilege in this time and place, and you didn't earn the privileges that come with being white. You never earned, because you're just born that way, right? And so it's about being an individual who promotes culturally safe relationships. But again, in the same way that I just talked about, it's also being an individual who advocates for culturally safe systems, so that interrogates those systems to say, is this just? Is this fair? Are, in this case, Indigenous people going to feel safe as a person of Indigenous ancestry in this system? And if not, how can we change it? The other thing that we encourage people to do is to become what we call an ally. This is a fairly new term. If you're not familiar with it, you'll probably know it from in the context of armed conflict, right? An ally is someone who stands next to you in a fight, right? And so the term is being used in a purposeful way, because we are kind of in a fight. But it's a fight to retain cultures, dignity, language, and self-governance and self-determination, right? So that's the fight people are in right now. And unfortunately, there is conflict. So when you decide to become an ally in that conflict, you have to be recognized by the community as an ally, right? If I come and stand beside someone and say, I'm an ally, well, that person might look at me and say, what have you done to deserve that recognition as ally? So what we do is we strive to act in ways that we are recognized by community as allies, not that we identify ourselves that way, right? So that's a really important thing. And oftentimes people will say, I'm attempting to be an ally, or I'm an ally in training, or I would, I aspire to be an ally, right? And until the community says to, in this case, a non-Indigenous person, you are an ally, then we're still striving. And that's a relationship that we have to sustain in ways that, are meaningful, again, to the community. The issue of diversity and inclusiveness is often, people see that, they often think, well, I'm already doing that if I'm doing Indigenous, anything, right? But we have to understand that there are environments or determinants in which, that are at different levels of engagement that are going to be important for us to understand. So I use the tree model for understanding sort of Indigenous determinants of health. So the stem environment where, the crown of the tree is, the core environment, which would be like the trunk, and then the roots, right? So at the stem environment, we're engaging with a whole bunch of people who live in all kinds of different environments, right? Urban, rural, remote, right? We're working with people who are, in community clinics, in large hospitals, so all of those sort of environments where we're having a direct contact with people. We need to understand that those are different than the core environments, which are the systems in which we work. They could be the community systems, they could be the public health systems, they could be health services systems, right? So, but that's a different kind of environment than the STEM environment. And then at the root, those are the political, historical, economic, cultural environments that really are the foundation of all of the rest of that tree, right? So when we're working in those environments, we're not having direct contact with people. Now we're attacking things like, or we're working toward things like policy, right? And racism, those things that are deeply embedded, right? So it's important to understand the diversity of even what we call these social determinants of health. And then it's also important, and I hear this a lot with students, where students are talking about Indigenous culture, singular. So we have to understand that Indigenous peoples are as diverse as anyone in Europe. So if you go to Scotland, you don't know anything about Italian people, right? It's not the same culture, it's not the same language, it's not the same history. In the same way, we have to understand that there are many, many Indigenous peoples, mostly very locally situated, with ties to a particular territory, culture, language, but even within those communities, there's lots of diversity, gender, age, sexuality, other things that are relevant for their identity, status, non-status, right? And so understanding the diversity of Indigenous peoples within and across communities is really important, and then trying to be inclusive of that diversity, right? So again, we often just don't think of Indigenous peoples, plural, as diverse. The communication stuff, I'm hoping, is pretty straightforward for all of you. But again, if we're seeking to communicate with folks, to have a relationship with folks, we have to know the people in community, however it's defined, as the knowledge holders, but also as the people who will pass along knowledge. Like, who are the people that people go to in this community to find out what's going on, to understand what the priorities are, to have decisions made, right? So who are the knowledge holders in that community? Because the knowledge holders don't just sit on old traditional knowledge. These are people who are generating that knowledge and often analyzing or interpreting knowledge from the outside to make it relevant for the people that work in, or live in that community. Where are the community voices? So who do we need to communicate with in order to understand the context of that particular community, how best to work with that community? And do we even know who the people are that we're trying to communicate with? Do we know the community well enough? Have we established relationships with that community in ways that will allow us to know them, to know the people that we need to talk to? And again, the default for most of us is written, text. It's quick. It's especially in the days of our, well, not mine, but your, what are they called? Text phones, yes, cell phones. I know what they're called, I just forgot. And so in this era of quick text, a lot of times you're going to totally ignore a very large proportion of community that doesn't really engage that way. And I'm not saying people don't engage that way in a day-to-day, but when we're trying to establish relationships for the purposes of doing something that's going to benefit community, this is more serious stuff. This requires us to go to people's homes sometimes. Someone wrote a paper recently and said something about Indigenous CBR. It's like the first 10 cups of tea are like the beginning. It takes like 10 cups of tea before you can start a conversation, oftentimes with an older elder. And so, but again, the relationship that you have with the community will tell you, or you'll be able to start to understand the ways in which knowledge sharing happens in that particular context. And so we adapt our communication in the ways that are most relevant for that community or that culture. And then we have to think about, how are we communicating? Are we taking a top-down approach where we just say, here's the thing, tell me what you think, or don't, right? Or are we saying, here's the information that we've gathered so far from lots of different sources, community, academic, public, whatever. Let's make meaning of this together. Let's sit down together, and again, that means engaging with people, and try to make meaning of this in ways that it's going to be relevant for this community or this cultural group. And then finally, leadership. Does the community lead? And by leadership, I'm talking about decision-making. Not just saying, yeah, communities, there's a rep on our advisory committee, because that's tokenism, and that makes people upset. If you don't think we talk about it, we do, about being tokenized. And so in order to establish the community leadership, we really do have to understand what the values and the visions and the priorities of that community are, right? So we can understand who in that community has the designated authority to lead in this particular context, because there isn't a single leader in community. The chief and council are not the leader of the community, right? Often people think that's an imposed structure, colonial structure. There are hereditary chiefs, there are clan mothers, there are knowledge holders, there are elders councils, there are health directors, there are dozens and dozens of different people who may be in a position to lead. What is what is the context and the vision and the priorities for them? Then we know who's leading in that particular way. Are we using the principles of OCAP? Ownership, control, access, and possession. This is a framework that was developed by Jeff and others to govern research that involves Indigenous people. But these same principles apply to public health. Does the community own the process? Does the community control the process? Does the community have access to their own information and data? And does the community, where possible, possess that information themselves? They don't have to go cap in hand to someone else. Again, these are aspirational principles. Oftentimes we can't apply all of them, but they are aspirational for all of us. And that's about leadership, community leadership. We often think about performance standards as something that we determine for the people that we work with. So if we think about ourselves as working in service to the wellness, not necessarily directly to communities, but to the wellness of communities, then what are the performance standards for us that are being laid down by community? What does the community expect of us, and how can we fulfill that? Because if we buy into the leadership, the model that I'm talking about, we are working in service to those communities. And then what capacities do those communities have from their perspective, not ours, and what do they wish to develop or enhance? Again, from their perspective, not ours. We help communities be leaders by giving over power, but also advancing their capacity to own, to control, and to lead. So I'm just going to leave you with some teachings that I've received, and these are in no way things that I have thought up, but they are things that I aspire to because people with a lot more wisdom than I have have conveyed them to me. And these are things that if you think about, sometimes we talk about, we hold things in a bundle and we carry them with us. And oftentimes they can be physical things that are significant to us, but sometimes that bundle can be a virtual thing. It can be teachings that we carry with us and we try to apply in our daily lives. So I'm just sharing these because they were given to me. I'm not suggesting that you have to take them, but they've been meaningful teachings that I've received. And that there is value in seeing things through many eyes. One of our very well-respected and loved elders, Albert Marshall, coined this term two-eyed seeing. And he suggests that we draw from the strength of the Indigenous eye and the strength of the Western eye, that we bring those two knowledge systems together for the benefit of everyone. And so pluralism has always been something that I have aspired to, because I really do believe that when you turn 360 degrees around something and try to look at it from a perspective, even a perspective that you don't agree with, you will understand that better, right? From that sort of multiple lens. Healthy relationships are based on shared power, right? If we are willing to give up power, most of you are in some kind of an intimate or personal relationship, and you know that when you try to draw power or have power over someone, your relationship will likely not be as healthy as it could be. Leaders work in service to communities. So I've learned this from the time I was a little girl, which is to say that you don't lead anyone. Jeff always says if you see yourself as a leader, you're likely going to turn around and see nobody behind you. And in the context in which we work, that's certainly the case. That we don't define ourselves as leaders. We are defined as leaders when we work in service to others, because others know that we're conscientious, that we have values, that we're trying to be ethical, and so they will sometimes look to us. Knowledge is not the same as wisdom. And so sometimes, this environment, unfortunately, socializes us to be a bit arrogant about ourselves and think that we know a lot. And when we encounter people who live in community who may not be as well educated as we are, who may not have the same credentials behind their name, or even the same life experiences, travel and glitz and glamour, like all of you have, as I can tell by the way you're sitting. But they have a wealth of experience that sometimes we will never understand, right? And a wealth of wisdom. Wisdom is about taking what we've learned and incorporating it into who we are. And I would suggest that some of the wisest people I've met are people with no education at all. And so that's a teaching that I've held close to my heart. Mistakes are the best teachers. The first person, other than just sort of knowing this intuitively, the first person that said this to me was an Inuit elder, and who said, suffering is a teacher. And that when we make mistakes or we suffer a loss, if we're trying to gain wisdom, we look to see what the teaching in that loss or that mistake or that problem is. And oftentimes that will help us to develop ourselves. And humility, again, this is a tough one because people often feel as though humility is a weakness. And in the teachings that I've received, being humble with another person, even someone who's trying to assert power over you, is a gift to them as well as yourself. And this is one I struggle with, and I think a lot of us do, because I feel false pride. Don't say that to me. Do you know who I am? Nobody. I don't mean that in any, I just mean like, who are you to talk to me that way? And I'm, so this is a tough one that we struggle with. But I have at least experienced that when I give humility, when I give over my power and I humble myself to others, then it actually makes me feel better about the relationship, and it often enhances that relationship as well. So I want to thank you all for listening to me rant, and I think we have 5 minutes for questions, if you have questions or comments or heckles. Does anyone have any questions or comments? I could do a pop quiz. What is public health science?
Yeah. So questions, comments? I'm really interested in hearing how people have attempted to do some of these things already, all my social justice folks. Any examples of actions you've taken? Or questions for Charlotte?
Jeff, you're a plant.
Yeah, Jeff, you are a plant.
Do you want to say something?
Yes.
Yes.
I liked your slide on leadership. Like, I liked the whole presentation, but the leadership was important. And I think maybe we could have a discussion about service-based or in-service leadership. And because everybody in this room is an emerging leader because they have the credential, right? They can put their, they can be in the business of leading in public health, but the meaning is different, and that's what you were trying to say. So, you know, service is critical to leadership, and I think that's kind of a core understanding, maybe expanding a little bit.
Well, I guess Mike, hold on to that mic, Jeffy, or Jeff, not Jeffy, don't call him Jeffy. I'm just interested in hearing from you. You know, I know that you have been a leader, whether you define yourself or that way or not, in Indigenous health research in Canada. And I know that it hasn't always been easy to be a leader because there's often folks who are not supportive of that kind of leadership from the top and from sort of the side. And do you have any sort of pearls around like how to navigate that kind of, I know that you've had to sort of fight against sort of the bureaucracy, but also some of the community conflicts that you've encountered. So do you have a...
Yeah, I mean, what I think I heard being said, and this is true of Indigenous health, but also in the work that Kathy does and the work that every one of you do, it's that making the effort to go out there and forge relationships with people who are of a like mind, who are passionate about equity and anti-racism and inclusion, and all those things that we hold as core values, and to create relationships with a common sort of game or goal. And those relationships can be created with people in overseas, and you know, you wind up with this powerful network of people who are committed, and then you start to go forward as a collective, right? You have this passionate idea where you want to make change, and you influence, you know, policy, programs, service, the status quo, and I think that is really empowering. So I have been very fortunate to have the, you know, advice from people way smarter than me would say to me, here's what you need to do. And when someone does that, when someone makes time to give you their advice, that means they care about you. They're protecting you. They're saying, we think you are important, and we think that you can move an agenda. That's what leadership is about. It's getting that sweet spot with people who are willing to kind of cover your back, and they got your back, and then you go forward, and then when problems happen, they're there to support you too.
Yeah, thanks. I think we're out of time, but it doesn't seem like...
I think we're close. Can I maybe...
Looks like
is there a question?
Front row here. Sadell?
Yep, there is. And maybe I can add one thing to that, Jeff, because I think as I'm reflecting on it and I'm thinking about it, I think it's also in the spaces you choose not to inhabit, right? So I know that, as you said, you get invited to a space. You don't impose yourself on a space. So, but there's also a bit of sort of ethical assessment that goes on. Is this a space, if I'm being invited in, is this a space I think is going to be a positive one? Is this a work environment that is going to be one that will promote the values that I share? Is this a space where I'm going to feel like people have my back, when we get into those moments of conflict, right? Is there going to be mutual respect and a way of, and an understanding that we're going to, work together to get through whatever the sticky bits are. And if that's not the case, then it's often the wisest choice not to go into that space in the first place, because those are the times when you find yourself frustrated and angry and feeling disrespected, and I heard you kind of allude to that, right?
Yeah.
Because you're pushing against something that's not ready to be pushed yet. So maybe it's better to go into a different space and push from there.
Yeah.
Right?
And it's important to understand that we have to be invited into spaces, but it's also, we can't use that as an excuse for not doing anything. Because I say, oh, well, I don't want to be, I want to wait. It's that we present ourselves as someone who is willing to help rather than someone who has a request. So I'm sure we all can't count the number of times we get cold called or emailed with a very blunt request to do something for somebody else. And in our context, that's rude. And so we don't replicate that when we're asking. If we have a long-term vision for doing something in a community, we don't begin with an ask of the community. We begin with, what can I do for you? What can I do for you for years until you think that I'm, the right person to help you with some kind of problem? Go ahead.
So this might be a too focused of a question, but I used to work in children's services when I was in Alberta. Yeah, and it was an awful system to work within, but we were constantly trying to be respectful, and we were told to be respectful and to build relationships while also in a really authoritarian position.
Yeah.
So how do you go into those, or what's your advice for people who are in those systems, who are trying to forge relationships and come to, a mutual goal of, in this specific example, safety of children?
Yeah.
How do you forge a relationship and make that the common goal without, I guess, being too authoritative in your work?
Yeah, and so I have some really amazing colleagues that are that work in Hulitan, which is an Aboriginal designated child and family services organization here in Victoria, and they serve all the urban Indigenous people here. And they work with the MCFD, the Ministry for Child and Family Development, but they have actively indigenized their entire process, clearly because they work only with Indigenous peoples. But one of the projects that I've just finished with them is not revising, but creating a new parenting assessment tool that is culturally informed, that has been created by Indigenous folks, that is based on the values of Indigenous peoples in this area. And MCFD has accepted that tool as valid for assessment, and it's I don't know, we haven't measured the impact of it yet, but I would say if I were a person working in MCFD, I would want to know those people. I would want to know those folks at Hulitan or an Indigenous organization that's doing the same kind of work, and I would want to start to talk to them about how can we work together, how can we change things so that this is a fair and equitable system for Indigenous peoples and families and children, right? Sometimes, yeah.
Well, thank you, Charlotte. I mean, that was
Thank you.
pretty amazing.
What
Now,
fun.